Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
The nurse is caring for a 22-year-old G2, P2 client who has disseminated intravascular coagulation after delivering a dead fetus. Which finding is the highest priority to report to the healthcare provider? 1. Activated partial thromboplastin time of 30 seconds. 2. Hemoglobin of 11.5 grams per deciliter. 3. Urinary output of 25 milliliters in the past hour. 4. Platelets at 149,000. The correct answer is 3. Urinary output of less than 30 milliliters per hour indicates renal compromise and would be the most important assessment finding to report to the healthcare provider. The APTT is within normal limits, and the hemoglobin is lower than value for an adult female, but within normal limits for a pregnant female. Although the platelet level is slightly low and may impact blood clotting when compared to renal failure, it is less important. As part of the preoperative teaching for the family of a child undergoing a tetralogy of Fallot repair, the nurse tells the family upon returning to the pediatric floor that the child may 1. Be placed on a reduced sodium diet. 2. Have an activity restriction for several days. 3. Be assigned to an isolation room. 4. Have visits limited to a select few. The correct answer is 1. Because of the hemodynamic changes that occur with open heart surgery repair, particularly with septal defects, transient congestive heart failure may develop. Therefore, the child's sodium intake typically is restricted to 2 to 3 grams per day. Activity restrictions are inappropriate. Typically, the child is encouraged to walk the halls and unit. Risk for infection after the repair is the same as any postoperative client. Therefore, isolation is not necessary. The child may be placed in a room with other children who are not contagious. Visitors are not restricted unless the pediatric unit has restrictive visiting policies. A client presents to the OB triage unit with a report of bright red vaginal bleeding that has saturated a peri-pad over the last hour. The nurse observed the fetal heart rate with a baseline of 130 decreasing to 100 for 60 seconds and then returning to 130. There are no contractions present. Which are the priority nursing interventions? 1. Ask client time of last oral intake and prepare to start an IV. 2. Continue to observe, monitor, and perform Leopold's maneuver. 3. Apply oxygen by face mask and perform sterile vaginal exam. 4. Place client in hands and knees position and call primary healthcare provider. The correct answer is 1. Because the woman is currently bleeding and the fetal heart rate is showing decelerations, the woman would need fluid replacement and a possible emergent cesarean birth. The woman may also need fluid volume replacement. The nurse can prepare for this by asking last oral intake, obtaining IV access. The client should be placed in a lateral position to enhance uteroplacental blood flow and given oxygen. The nurse should notify the primary healthcare provider as soon as possible, but the hands and knees position is indicated only if the client is experiencing back labor or umbilical cord prolapse. Leopold maneuver is done to determine fetal position in utero and would have already been done prior to placing the fetal heart rate monitor. After surgery to correct the tetralogy of Fallot, the child's parents express concern to the nurse that their 4-year-old child wants to be held more frequently than usual. The nurse recommends 1. Introducing a new skill. 2. Play therapy. 3. Encouraging behavior. 4. Having the volunteer hold the child. The correct answer is 2. The child is exhibiting regression. During periods of stress, children frequently revert to behaviors that were comforting in earlier developmental stages. Play therapy is one way to help the child cope with the stress. Teaching a new skill most likely would add more stress. Parents should be instructed to praise positive behaviors and ignore regressive behaviors rather than calling attention to them through encouragement or discouragement. Having someone else hold the child does not encourage coping with the stress or promoting appropriate development. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Apply an external fetal monitor and complete physical assessment. 2. applying external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. The mother of a child hospitalized with tetralogy of Fallot tells the nurse that the child's 3-year-old sibling has become quiet and shy and demonstrates more than a usual amount of genital curiosity since this child's hospitalization. The nurse should tell the mother, 1. This behavior is very typical for a 3-year-old. 2. This may be how your child expresses feeling a need for attention. 3. This may be an indication that your child might feel responsible. 4. This may be a sign of depression in your child. The correct answer is 2. According to Erickson, the central psychosocial task of a preschooler is to develop a sense of industry versus guilt. Any environmental situation may affect the child. In this situation, the sibling is probably feeling less attention from the mother and trying to resolve the conflict in an inappropriate way. 3-year-olds are usually active and outgoing. These behaviors represent a change. Symptoms of depression would include withdrawal and fatigue. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when the client states which of the following? 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. 4. I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension. A laboring client with preeclampsia is prescribed magnesium sulfate 2 grams per hour IV piggyback. The pharmacy sends the IV to the unit, labeled magnesium sulfate 20 grams per 500 milliliters normal saline. To deliver the correct dose, the nurse should set the pump to deliver how many milliliters per hour? Blank ml. The correct answer is 50 milliliters. You set up the formula as 500 milliliters over 20 grams multiply by x over 2 grams. You cross multiply and get 1,000 equals 20x. You divide 1,000 on both sides and you get x equals 50. After reinforcing the danger signs to report with gravida 2 client at 32 weeks gestation with an elevated blood pressure, which client statements would demonstrate her understanding of when to call the primary healthcare provider's office. Select all that apply. 1. If I get up in the morning and feel dizzy, even if the dizziness goes away. 2. If I see any bleeding, even if I have no pain. 3. If I have a pounding headache, that doesn't go away. 4. If I notice the veins in my legs getting bigger. 5. If the leg cramps at night are waking me up. 6. If the baby seems to be more active than usual. The correct answers are 2, 3, and 6. Vaginal bleeding with or without pain could signify placenta previa or abruptio placentae. Continuous or pounding headache could indicate an elevated blood pressure and change in the strength or frequency of fetal movements could indicate that the fetus is in distress. Orthostatic hypotension can occur during pregnancy and can be alleviated by rising slowly. Leg veins may increase in size due to additional pressure from the increasing uterine size, while leg cramps may also occur and can commonly be decreased with calcium supplements. A 32-year-old multigravida returns to the clinic for a routine prenatal visit at 36 weeks gestation. The assessments during this visit include BP 140 over 90, pulse 80, and +2 edema of the ankles and feet. What further information should the nurse obtain to determine if this client is becoming preeclamptic? 1. Headaches. 2. Blood glucose level. 3. Proteinuria. 4. Edema in lower extremities. The correct answer is 3. The two major defining characteristics of preeclampsia are blood pressure elevation of 140 over 90 or greater and proteinuria. Because the client's blood pressure meets the gestational hypertension criteria, the next nursing responsibility is to determine if she has protein in her urine. If she does not, then she may be having transient hypertension. The edema is within normal limits for someone at this gestational age, particularly because it is in the lower extremities. The preeclamptic client will have significant edema in the face and hands. Headaches are significant in pregnancy-induced hypertension, but may have other etiologies. The client's blood glucose level has no bearing on a preeclampsia diagnosis. An obese 36-year-old multigravida client at 12 weeks gestation has a history of chronic hypertension. She was treated with methyl-dopa before becoming pregnant. When counseling the client about diet during pregnancy, the nurse realizes that the client needs additional instruction when she states which of the following. 1. I need to reduce my caloric intake to 1,200 calories per day. 2. A regular diet is recommended during pregnancy. 3. I should eat more frequent meals if I get heartburn. 4. I need to consume more fluids and fiber each day. The correct answer is 1. Pregnancy is not the time for clients to begin a diet. Clients with chronic hypertension need to consume adequate calories to support fetal growth and development. They also need an adequate protein intake. Meat and beans are good sources of protein. Most pregnant women report that eating more frequent, smaller meals decreases heartburn resulting from the reflux of acidic secretions into the lower esophagus. Pregnant women need adequate hydration and fiber to prevent constipation. The nurse is instructing a preeclamptic client about monitoring the movements of her fetus to determine fetal well-being. Which statement by the client indicates that she needs further instruction about when to call the healthcare provider concerning fetal movement? 1. If the fetus is becoming less active than before. 2. If it takes longer each day for the fetus to move 10 times. 3. If the fetus stops moving for 12 hours. 4. If the fetus moves more often than 3 times an hour. The correct answer is 4. The fetus is considered well if it moves more often than 3 times in 1 hour. Daily fetal movement counting is part of all high-risk assessments and is a non-invasive, inexpensive method of monitoring fetal well-being. The healthcare provider should be notified if there's a gradual slowing over time of fetal activity, if each day it takes longer for the fetus to move a minimum of 10 times, or the fetus stops moving for 12 hours or longer. The nurse is reviewing the chart of a multigravida client at 39 weeks gestation with suspected HELLP syndrome. The nurse should notify the healthcare provider about which of the following test results. 1. Platelets 200,000. 2. Lactate dehydrogenase greater than 200 units per liter. 3. Uric acid 3 milligrams per deciliter. 4. Aspartate aminotransferase 15 units per liter. The correct answer is 2. The normal value of LDH in a non-pregnant person is 45 to 90 units per liter. LDH elevations indicate tissue destruction that can occur with HELLP syndrome. This platelet range is in the normal range and remains unchanged during pregnancy. Uric acid in a non-pregnant woman is 2 to 6.6 milligrams per deciliter. AST normal range is 4 to 20 units per liter. A 29-year-old multigravida at 37 weeks gestation is being treated for severe preeclampsia and has magnesium sulfate infusing at 3 grams per hour. To maintain safety for this client, the priority intervention is to 1. Maintain continuous fetal monitoring. 2. Encourage family members to remain at bedside. 3. Assess reflexes, clonus, visual disturbances, and headache. 4. Monitor maternal liver studies every 4 hours. The correct answer is 3. The central nervous system functioning and freedom from injury is a priority in maintaining well-being of the maternal fetal unit. If the mother suffers CNS damage related to hypertension or stroke, oxygenation status is compromised and the well-being of both mother and infant are at risk. Continuous fetal monitoring is an assessment strategy for the infant only and would be of secondary importance to maternal CNS assessment because maternal oxygenation will dictate fetal oxygenation and well-being. In preeclampsia, frequent assessment of maternal reflexes, clonus, visual disturbances, and headache give clear evidence of the condition of the maternal CNS system. Monitoring the liver studies does give an indication of the status of the maternal system, but the less invasive and highly correlated condition of the maternal CNS system in assessing reflexes, maternal headache, visual disturbances, and clonus is the highest priority. Psychosocial care is a priority and can be accomplished in ways other than having the family remain at the bedside. A client at 36 weeks gestation begins to exhibit signs of labor after an eclamptic seizure. The nurse should assess the client for 1. Abruptio placentae, 2. Transverse lie, 3. Placenta accreta, 4. Uterine atony. The correct answer is 1. After an eclamptic seizure, the client is at risk for abruptio placentae due to severe vasoconstriction resulting in hemorrhage into the decidua basalis. Abruptio placentae is manifested by a board-like abdomen and an abnormal fetal heart rate tracing. Transverse lie or shoulder presentation, placenta accreta, and uterine atony are not related to eclampsia. Causes of a transverse lie may include relaxation of the abdominal wall secondary to grand multiparity, preterm fetus, placenta previa, abnormal uterus, contracted pelvis, and excessive amniotic fluid. Placenta accreta, a rare phenomenon, refers to a condition in which the placenta abnormally adheres to the uterine lining. Uterine atony, or relaxed uterus, may occur after childbirth, leading to postpartum hemorrhage. At 32 weeks gestation, a 15-year-old premigravida client who is 5 feet, 2 inches has gained a total of 20 pounds, with a 1 pound gain in the last 2 weeks. Urinalysis reveals negative glucose and a trace of protein. The nurse should advise the client that which of the following factors increases her risk for preeclampsia. 1. Total weight gain. 2. Short stature. 3. Adolescent age group. 4. Proteinuria. The correct answer is 3. Clients with increased risk for preeclampsia include primigravida clients younger than 20 years or older than 40 years, clients with 5 or more pregnancies, women of color, women with multi-fetal pregnancies, women with diabetes or heart disease, and women with hydramnios. A total weight gain of 20 pounds at 32 weeks gestation, with a 1 pound weight gain in the last 2 weeks, is within normal limits. Short stature is not associated with the development of preeclampsia. A trace amount of protein in the urine is common during pregnancy. However, protein amounts of 1+ or more may be a symptom of pregnancy-induced hypertension. Following an eclamptic seizure, the nurse should assess the client for which of the following: 1. Polyuria, 2. Facial flushing, 3. Hypotension, 4. Uterine contractions. The correct answer is 4. After an eclamptic seizure, the client commonly falls into a deep sleep or coma. The nurse must continually monitor the client for signs of impending labor, because the client will not be able to verbalize that contractions are occurring. Oliguria is more common than polyuria after an eclamptic seizure. Facial flushing is not common unless it is caused by a reaction to a medication. Typically, the client remains hypertensive unless medications, such as magnesium sulfate, are administered. After instructing a premigravida client at 38 weeks gestation about how preeclampsia can affect the client and the growing fetus. The nurse realizes that the client needs additional instruction when she says that preeclampsia can lead to which of the following? 1. Hydrocephalic infant. 2. Abruptio placentae. 3. Intrauterine growth restriction. 4. Poor placental perfusion. The correct answer is 1. Congenital anomalies such as hydrocephalus are not associated with preeclampsia. Conditions such as stillbirth, prematurity, abruptio placentae, intrauterine growth restriction, and poor placental perfusion are associated with preeclampsia. Abruptio placentae occurs because of severe vasoconstriction. Intrauterine growth restriction is possible owing to poor placental perfusion. Poor placental perfusion results from increased vasoconstriction. A 16-year-old unmarried premigravida client at 37 weeks gestation with severe preeclampsia is in early active labor. The client's blood pressure is 164/110, which of the following will alert the nurse that the client may be about to experience a seizure? 1. Decreased contraction intensity. 2. Decreased temperature. 3. Epigastric pain. 4. Hyperreflexia. The correct answer is 3. Epigastric pain or acute right upper quadrant pain is associated with the development of eclampsia and an impending seizure. This is thought to be related to liver ischemia. Decreased contraction intensity is unrelated to the severity of the preeclampsia. Typically, the client's temperature increases because of increased cerebral pressure. A decrease in temperature is unrelated to an impending seizure. Hyperreflexia is not associated with an impending seizure. Typically, the client would exhibit hyperreflexia. After instructing a multigravida client diagnosed with mild preeclampsia how to keep a record of fetal movement patterns at home, the nurse determines that the teaching has been effective when the client says that she will count the number of times the baby moves during which of the following time spans? 1. 30-minute period 3 times a day. 2. 45-minute period after lunch each day. 3. 1-hour period each day. 4. 12-hour period each week. The correct answer is 3. Numerous methods have been proposed to record the maternal perceptions of fetal movement or kick counts. A commonly used method is the Cardiff count to 10 method. The client begins counting fetal movements at a specified time and notes the time when the 10th movement is felt. If the client does not feel at least 6 movements in a 1-hour period, she should notify the healthcare provider. The fetus typically moves an average of 1 to 2 times every 10 minutes, or 10 to 12 times per hour. A 30 or 45-minute period is not enough time to evaluate fetal movement accurately. The client should monitor fetal movements more frequently than 1 time per week. 1 hour of monitoring each day is adequate. A premigravida client with severe preeclampsia exhibits hyperactive, very brisk patellar reflexes with 2 beats of ankle clonus present. The nurse documents the patellar reflexes as which of the following? 1, 1 plus, 2, 2 plus, 3, 3 plus, 4, 4 plus. The correct answer is 4. These findings will be documented as 4 plus. 1 plus indicates a diminished response. 2 plus indicates a normal response. 3 plus indicates a response that is brisker than average but not abnormal. Mild clonus is said to be present when there are 2 movements. When teaching a multigravida client diagnosed with mild preeclampsia about nutritional needs, which of the following types of diet should the nurse discuss? 1. High residue diet. 2. Low sodium diet. 3. Regular diet. 4. High protein diet. The correct answer is 3. For clients with mild preeclampsia, a regular diet with ample protein and calories is recommended. If the client experiences constipation, she should increase the fiber in her diet, such as by eating raw fruits and vegetables and increase fluid intake. A high residue diet is not a nutritional need in preeclampsia. Sodium and fluid intake should not be restricted or increased. A high protein diet is unnecessary. After administering hydralazine 5 milligrams intravenously as prescribed for a premigravida client with severe preeclampsia at 39 weeks gestation, the nurse should assess the client for 1. Tachycardia, 2. Bradypnea, 3. Polyuria, 4. Dysphagia. The correct answer is 1. One of the most common adverse effects of the drug, hydralazine, is tachycardia. Therefore, the nurse should assess the client's heart rate and pulse. Hydralazine acts to lower blood pressure by peripheral dilation without interfering with placental circulation. Bradypnea and polyuria are usually not associated with hydralazine use. Dysphagia is not a typical adverse effect of hydralazine. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the 3rd trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. As the nurse enters the room of a newly admitted premigravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. Which of the following should the nurse do first? 1. Insert an airway to improve oxygenation. 2. Note the time when the seizure begins and ends. 3. Call for immediate assistance. 4. Turn the client to her left side. The correct answer is 3. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. The nurse needs to have some assistance in managing this client. After the seizure, the client needs intensive monitoring. An airway can be inserted, if appropriate, after the seizure ends. Noting the time the seizure begins and ends and turning the client to her left side should be done after assistance is obtained.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.